Hello friends, welcome back. In this video, we shall be looking at how homeopathy can help in accidents which involve burns and scalds. Burns can be serious, and that is why we will take up the red flag or the red line which you should never cross. If the area of a burn or scald is bigger than the palm of a hand, you need medical attention. If the skin looks leathery or if the skin is charred. Similarly, if the person is having difficulty in breathing or if the burn is caused by chemicals or electricity. All these require medical attention. So at best you can provide first aid, and the 6 remedies that we are going to discuss will bring tremendous relief to your patient. First, we will distinguish between a burn and a scald. Burns are caused by heat or by friction, by chemicals and electricity, whereas scalding occurs exclusively due to hot liquids. The two pictures show the appearance of superficial burns and scalds to the skin. The graphic on your screen shows the different layers of the human skin. Right on the top is shown as epidermis. This is the outermost layer. Just below that is the dermis, and below that is the subcutaneous tissue, and deeper still is muscle. The severity of burns is often described by doctors in terms of degrees. A first-degree burn affects only the epidermis, and the appearance of the skin is red and it is painful. The blisters are not there. A second-degree burn or scald will show redness and blistering. It affects the superficial dermis. You must consult a doctor. The third-degree burn, the epidermis is completely lost. And these are usually caused by flames or by steam, hot oil, or high voltage. In such cases, the nerves can also be damaged. The more severe burns are of the fourth degree, and over here the dermis and muscle tissue are also destroyed, and usually a skin graft may be required. There is also a possibility of permanent motor damage to the nerves. Fifth degree obviously is the most severe of burns. The skin and the subcutaneous tissue is destroyed, muscles are exposed, and to a large extent they also suffer damage. It also burns out or affects or destroys the veins and arteries, and this can be fatal. This graphic gives us a good idea about what temperatures mean when it comes to burns and scalds. A 2-second exposure at 63 degrees Celsius can cause burns serious enough that require surgery. Further, it says coffee is often served at 80 degrees Celsius, making it high risk for causing severe burns. Flowcharts provide a very easy way of determining the remedy required. This flowchart is the first among the few that we'll be discussing. In case of a burn, first determine if it is a sunburn, and if it is so, is it accompanied with a headache? If it is, then your remedy is belladonna. If it is a sunburn without a headache, check out if there is any itching in the area where there is a sunburn. If yes, then your remedy is urtica, Urtica arens. If there is no itch, then check out if there is redness and throbbing. If it is indeed red and there is a throbbing sensation, your remedy once again is belladonna. If there is in fact redness and throbbing and blistering, then the correct remedy will be cantharis. We shall be talking more about this remedy later. However, as you saw, this was for sunburns only. What about other burns which are more common? For that, we'll see the next page. Continuing further, let us look at some other kinds of burns. But first of all, we must establish whether the person who is affected is in a state of shock. If that be the case, then the best remedy is aconite. Aconite is a very fast acting remedy and it is best used when there is a shock and especially the initial stages. If that is not the case, check out if there is any stinging sensation or there is itching. If that is the case, then the remedy is urtica, as we saw earlier, for similar symptoms in the case of sunburns. If not, then check out if there is blistering or cracked skin. In that case, your remedy is causticum. Sometimes there may be no blistering or cracked skin, but there may be a severe burn and you would like to rush that person to a medical doctor. Under such circumstances, the first aid that will come to the rescue of the person is cantharis. And as said earlier, we shall be doing a case study on this particular remedy a little while later. There is one more remedy I would like to discuss here, which is for deep burns. Although deep burns would require medical treatment from a qualified doctor, you can still assist the patient's recovery by giving a very effective remedy. And that comes in handy when there are vesicles on the skin and there is infected flesh. If that is the case, the remedy is arsenicum album. This will tremendously help in the recovery and shorten the time to getting better. We will now take a deeper look at each one of the 6 remedies that we discussed in this lesson so far. The first one, of course, is aconite. Aconite is always indicated when the person is in a state of shock. Further, very often the face will be red and will have a painful demeanor. The pulse is hard, frequent, and contracted. The skin will be burning and dry, and the patient will show signs of panic and restlessness. Very often, like arsenicum, the person may have a fear of death. Dry air will aggravate the symptoms, whereas deep breathing helps a person. Warmth also ameliorates. Further, one characteristic symptoms peculiar to aconite is that after severe burns, the person may have colicky pains. So that was our aconite for us. The next remedy that we are considering is arsenicum album. Arsenicum album will show signs of inflammatory swelling. And as mentioned earlier, there will be vesicles, which means eruptions with fluid and infected flesh. The pains will be described as burning or lancinating, means as if somebody is piercing the skin with a lance or needles. The person thinks that it is useless to take any medicines. There is anguish, restlessness, and fear of death. These last 2 symptoms are quite common in aconite as well. The restlessness causes a person to change the place constantly. It could be changing sides if the person is lying down or changing the posture while sitting. Further, it is extremely useful if there is gangrene from the burns. So it is used in a very advanced and a severe stage of burn accidents. Belladonna is characterized by heat and redness. The skin will be hot and swollen, and very often there could be a rash, as we saw in the case of sunburns. The person will exhibit signs of shuddering and shivering, and light covering will make the person feel better. Touch and heat aggravate. So that was belladonna for us, for burns and scalds. Now we take a look at cantharis. Cantharis is actually the very first remedy that comes to the mind in case of any burn or scald for local application, and it can work wonders. Also, it is associated with vesicles forming on the skin. One strange characteristic is fearing a mirror in the room. Cold applications will ameliorate, touch aggravates, and most useful in all types of scalds and burns. Causticum is a remedy that's very useful when you have blistering or cracked skin with painful burns. Cold drinks ameliorate. Change in atmosphere aggravates. It's very useful in severe burns and for ulcers that originate from burns. Another very peculiar characteristic where causticum is most useful is when old burn injuries or scars reopen once again. Urtica is very useful as a first aid, especially for first degree burns when only the top skin is affected, which is the epidermis. There is itching and stinging. Lying down quietly helps or makes the person feel better. Touch aggravates, and it is accompanied with the redness, especially a rash, for example, following a sunburn. We will now take up a case study which was published back in 1896 in the 35th volume of Hahnemannian Advocate. This is in first person, written by a homeopath who suffered this particular tragic accident. He says, I was preparing some catgut ligatures. A jar of boiling alcohol exploded and it burnt my right hand and wrist quite seriously. Pain was intense and the parts were covered with oil and bandages, and yet there was absolutely no relief. Cantharix in the potency of 3x was put in water and applied. In the next slide we shall see how Cantharix 3x worked. Before we look at the outcome of the local application of Cantharix 3x, I would like to just recall that alcohol boils at 80 degrees Celsius. So it is a pretty serious accident. Now our homeopathic doctor has applied Cantharix 3x to the injured part. Within 5 minutes, the pain was gone entirely. Never returned. There was no blister, and within 6 hours, not a trace of discoloration was visible. This is really fantastic, especially for a burn that was caused by boiling alcohol, and as we saw, alcohol boils at 80 degrees Celsius. Recall the graphic which was shown earlier, where it mentioned that any burn or scald caused by a liquid above 63 degrees Celsius can be quite serious. So friends, in this lesson we have considered 6 remedies and we shall quickly do a recap. Here's a quick recap of the 6 remedies that we studied in this lesson. The first, of course, is aconite, which is characterized by shock. Arsenicum for much deeper injuries due to burns. Belladonna, characterized by redness and heat. Then we had Cantharix, which we saw is an excellent first aid and also acts in very severe cases as demonstrated by the case study. Causticum, and then finally Urtica. That brings us to the end of this lesson on burns and scalds. Thank you very much for your attention, and we shall meet once again in the next lesson. So until we meet, thank you and bye-bye.